So welcome everyone to our webinar. Today we are going to talk about how humanoid robotics can provide support in the healthcare industry. It's an honor to meet you, Professor Ralph Schulz. So thank you so much for being here today. Thank you so much, Alexander Paul, to be here with us. You are helping Dr. Joachim Schulz Hospital to deploy Pepper. Pepper is here with me, by the way. So let's start by asking you a short question. Maybe when was the first time you met Pepper? When was your first encounter with our humanoid robot?
Well,
so Professor?
Yes, actually, the first contact was by a newspaper, and I got interested in because we are looking in our hospital for emotional support and therapy, new therapy ways to treat people with cognitive deficits, geriatric patients. And we realized that there are coming up some tools to support a multidisciplinary therapy in geriatric patients in form of these new robotics.
Mm-hmm. Thank you, Professor. So what about you, Alexander? When did you meet Pepper for the first time? What did trigger your interest in Pepper?
Yeah, for me, it's nearly 4 years ago. So first time I met Pepper, and from the first time and from the first moment and interaction, it was quite fascinating because from the communication side and from the human and machine interaction, and that's where the story started with me.
Sounds good. So thank you so much. So both of you are based in Germany, and I'm in Paris at Softbank Robotics Europe headquarters. So let's start our webinar. Right now, what we want to share with you all is a special topic. It's about humanoid robots, of course, in the field of healthcare and how we can help elderly patients. So patients basically which are like over 80 years old and some of them with dementia, unfortunately. So we're going to talk about that today. As a quick introduction, Softbank Robotics is a Japanese company. We're based in Japan for headquarters and all over the world. And in Paris, we have a huge R&D development center with over 350 people. We've deployed over 25,000 now and Pepper robots. So now is a small one dedicated to the education market. Pepper is the one next to me, dedicated to humanoid emotions and service and healthcare. And we have a new robot called Wiz, which is like a vacuum cleaner, an automatic cleaner. So this is basically our portfolio. Pepper is a very special guest today. He's a humanoid robot. He can detect humans. And during the COVID-19 crisis, we decided to provide him with new features, especially features regarding social distancing. So helping kids understand that they need to keep the social distancing at all times, and of course to wear masks. So we have a face mask detection app on the robot that is working with some artificial intelligence algorithm to detect if you are wearing a mask or not. And with this gentle tone, Pepper can remind people to wear a mask or to wash their hands more often. To do that, we developed this during the summer in a very short sprint in software because we basically wanted to help our customers and to help hospitals. And we've been able to deploy this feature beginning of August and to use it in several places. As an example, Pepper was active in a quarantine hotels in Tokyo. We deployed it into live events. There are a few supermarkets in Germany using it, like the ADK stores, the small supermarket stores that you know very well in Germany, where Pepper is reminding shoppers to make sure that they keep the social distancing and they do not do things that are not good for the COVID-19 prevention. The same happens in airports. So in the Athens airport in Greece or in the Christchurch airport in New Zealand, Pepper is there to remind you to sanitize your hands and to get you know, your mask on back on. So that's basically what we've done with paper, but we did larger experimentation in the Paris hospital called Pitié-Salpêtrière, which is one of the oldest hospitals in our city. And their paper has been tested, deployed as an experimentation for telepresence. So especially in the very difficult time of COVID-19, in the resuscitation rooms with patients who really need a lot of care, and you know, they don't have a lot of good visions, and they have all the tubes and mask on, but they can use paper to talk to the family and patients. And of course, the family couldn't come into the hospital to visit them because of the COVID-19. So this is what we've been doing with the hospital Pitié-Salpêtrière and the Sorbonne University to try paper in a new way and to see with the medical staff is a robot, a humanoid robot can provide support. So this is what we have done in Paris as a test. And now we're going to go back to Germany and to see what you've been doing at the St. Marian Hospital with the help of Advanced Robotics. So Alexander Alwe and Professor Ralph Kim Schulz, we are really very interested in what you're going to discuss and share with us regarding paper used for geriatric patients.
Yeah, so so I would start. Here you see Pepper direct in the interaction with a nice old man and with the front end from our software, Robot Care. And next slide, please. So I would just do a quick introduction of our company. So we are Entrance Robotics, and our claim, our philosophy is welcome to the new digital life. So that means that we want to integrate software and technology which describes itself so proactively and helps us humans to have more comfort in life and perhaps more benefits. Next slide, please. So what we do, or what our company is about, so we are a team of 14 people. We are located in Wuppertal near Cologne. And the special part about us is like for more than 2 years, to be exactly 2.5 years now, we are focusing on healthcare with software integrations, hardware integrations, and the combination of different chatbot systems and IoT devices. And to be perfectly clear, up to now we successfully finished over 180 projects with robotics and digitization with software for service robotics. Okay, next slide, please.
Yeah, the St. Mary's Hospital is the oldest hospital in Cologne and is the teaching hospital of the University of Cologne. It's in Germany the second largest geriatric center and has at least right now 300 beds. It's in terms of teaching, we have a lot of research programs right now, and finally, we just yesterday we received a couple of tests, and we presented data already over the last 8 years about geriatric patients, and the hospital is focused more or less on multimorbid patients in terms of rehabilitation and treatment of multimorbidity in terms of internal medicine and neurology. Next slide. To my person, I'm the chief of the medical representation here in the hospital. I'm a specialist in internal medicine and gastroenterology, clinical nutrition, and geriatrics. And our special field is remobilization of patients after falls or with strokes and people who have dementia. I'm since 2012 member of the European Association for Geriatrics. Next slide.
We see, Professor, that you received an award from the Focus magazine as well.
Yes. And yesterday we received the prize of the German government of health here in North Rhine-Westphalia for the most innovative medicine in geriatrics.
Excellent.
Well, in this slide, you are able to realize that we have not only top weather conditions here in Cologne, but also we are dealing with functional tests and treatments in terms of emotions, cognition, recognition of people. And we also work with, on the slide on the right, with an exoskeleton to support movements after strokes and neural deficits. Pepper is in our hospital now introduced since 1.5 years mostly. The project has started now, and we are looking here for just first how people behave when they get in contact with this machine and artificial. And as you realize in the pictures, there are really so far no problems. Next.
Yeah. So from the challenges, that's what perhaps we can define our motivation, why we start up with some kind of health platform that we have on the one hand side shortages of specialists. So it's a big demand from the market, from the healthcare market, to have skilled workers to treat like people in need. Then we have the problem of the financial viability in care. That's why also we try to standardize really a process and the software and some kind of combination to help like clinics or like facilities for elderly care. And in the big picture, we have the demographic change. Okay, next slide, please. So very interesting and also very important is like overall globally we see at the moment like we have an increase of 75% of chronic disease, so by 2020. So it's quite the current perspective. Then we have a big amount of budget which is annually going into the healthcare system for treating these kind of chronic diseases and also following diseases. And also the very important fact is that by 2035, we will have globally a deficit of 12.9 million skilled health professionals. So we definitely see, not only in Germany, that's why we introduced this slide, that we have globally some kind of need to think about opportunities and different approaches, how we can help the healthcare system. Okay, next slide, please. So here you see a perspective from Germany. We have an increase of people in need. You see some kind of statistics which are referring to the year 2030 and also 2060. And to 2030, we will have an increase by 4% of the people in need. So people in need also here in focus of chronic disease and long-term treatment. And by 2060, like plus 8%. And in correlation, we have the problem that the health personnel, the professionals, from the resources, from human resources, they decrease. So it's a statistic right from this year. So we try to define this problem. Okay, next slide, please. The good thing is that the German government and also the European Union has defined this as a goal and also the possibilities of digitization. And here we add a quote from the federal government of Germany that it's a fact, and also politics and all involved partners know that digitization has to be used to solve this problem. Okay, next slide, please. And in addition to this, which would be enough for itself as a challenge, we now, as we know, globally, we face COVID-19, and COVID-19 for itself, as you, Nicolas, introduced before with the mask detection skill of Pepper, which is really helpful. We now have technology where we try to solve these problems with technology which appeared with COVID-19 for itself. And here it's also a really big topic is isolation. And isolation there from the groups of risk, of the high risk, like elderly people. We have many occasions where we already got feedback that they are on the only daily basis completely in isolation, and robots can help because there is interaction, there's potential, and there is the possibility to have this, to express also your feelings in the end. Okay, next slide, please. So what we do at Entrance Robotics is we established a platform. We call this Robot Care. And the very important part is that with this platform, we are able to have some kind of combination of different skills. That's what we call it. So here you see in the subsection different skills like activation, emotion detection, fitness, telepresence, and the detection of vital parameters. I will go through this later. And the good part is, like, for every facility or for every clinic, we can change and combine these skills in a special setup. So we have in the big picture, like the framework, so the platform we can work with, and the needs or the use cases we build up always depends on the individual needs. Okay, next slide, please. So the key principles of our software are to inform, to activate, to entertain, and to connect. You see this also on the picture, or with the picture on the right top. Mm-hmm. We always have a really simple approach, and with a simpler approach, we integrate different principles which you can always find again. So this is especially for elderly people, it's very important. So this is always this welcome to the new digital life. We have software and technology which defines itself and helps to understand it from yourself. So you don't have to learn like for a couple of weeks. Next slide, please. Here you see this lovely old lady. We have a big part about Pepper, and the usage of Pepper is to have this cognitive activation. And now we are step by step more approaching also to the support in dementia prevention, because we have this focus of interaction. Next slide, please. Here you see, we always have this, for this presentation, we defined our current status quo and also what's coming next, and also our final goal. With the activation, we are at the moment that we have a proactive service. So Pepper is engaging older people, giving concentration games, doing in general entertainment, but it's much more. So we have like activation through music. Music for elderly people is quite important to have this emotional interaction. Then we tell fairy tales with Pepper, and then also to trigger knowledge. So different styles of quiz interactions and gamification. So also with motivation to go on. On the progress, you see we are working on the product itself continuously. So for this instance, we have, which is also already live from this week, these regular content updates, and the rest you see on the slide there. So in the end, we want to have really support and analytics also for the professional staff, so they can have added to their documentation. Next slide, please.
So back to emissions.
Mm-hmm. So here we have a big point, which is really important also to the platform Pepper in general. We are working on an increased or improved emotion detection. For those who know Pepper, there is a very good basic level of emotion detection. So if we smile or if you look perhaps angry, but yeah, next slide, please. we are working on this to have an increased way of emotion detection. At the moment, to our status quo is, we have the possibility of the basic emotions, and we work with our dialogue system and with a small talk. When Pepper sees a smile, he adapts to his behavior, and with a smile, or he tries to trigger a smile by, for instance, jokes. And when he sees a smile, then he can adapt his behavior. So, and on the long run, here we also want to have this integration for diagnosis. And next slide, please. I think here, Professor.
So back to you, Professor.
I take over. Yeah. Well, as Alexander already mentioned, in our hospital, we try to get more information from cognitive impaired people with dementia, and they're usually not able to present their informations about feelings and emotions and pain, for example, in the correct way. So therefore, we try to get an impression about the situation of a cognitive impaired person by the detection of emotions with a machine. And this is for us very important, because everybody who's asking the patient, how do you feel today, is always suggestion, his own personal emotion, and is more or less interpreting the things very differently. So therefore, for a neutral detection of an emotion situation as a surrogate parameter of different therapy activations, and in terms of medication, in terms of pain treatment, but also depressions and dementia, we always are focused now on the situation to detect the emotion as a mirror of the real situation of this patient. So therefore, patient recognition and the face recognition might be a new way to detect the complete clinical situation of these people and navigate and interact with these patients in the right way. So mood recognition through optical analysis of the visual fields during patients' interaction by the robot, it might be a new way for a better treatment of patients with mild cognitive or dementia situations. So on the other hand, the reproduction of the patient's mood is very important. So you can detect probably by Pepper every day in the same way at this activation, interaction situation in this clinic unit and the patients, and get a more precise information and picture of these people. So monitoring and interpretation of the mood states without one-to-one observation by nursing staff is very interesting, and perhaps we save time by it and get a more precise picture by Pepper. So this is the reason why we integrated Pepper as a partner who is entertaining, but on the other hand, might be a good instrument to detect a surrogate parameter like the emotion of these difficult patient population. Next slide.
Yeah, so here you see Pepper right in action. So he has a big group of elderly people, and he is doing his fitness activation. This is one of the skills of robot care we talk about. And it's all about physical activation, because we want to achieve a healthy mind and in addition, a healthy body, and support these two factors which intervene. Next slide, please. At the moment, we have the possibility with this to, you can start with Pepper some kind of time program for fitness activation and select the length of the training. And he's demonstrating what's coming or what's coming up, or kind of movement for upper body, for instance. And then he always also comments while he's doing it, or mostly with like 3 or 5 repetitions. And in addition, we have a robot which has mimic and gestic, and doing motivation during this fitness program. We are increasing for the progress the amount and the possibilities you can adjust. And on the long run, we also want to integrate with Pepper that we have a more analytical way to have this, this movement training, which also adapts to the development of the patient or the elderly person. Okay, next slide, please. Here you see also one of the newest additions, the integration of Telepresence. They are quite surprised by the video, as you can see here, which is appearing on Pepper's tablet. Yeah, we're talking about video and audio interaction. Next slide, please. And this is pretty important right now because of COVID. So as I mentioned before, the isolation, it's very interesting and also very heartwarming that we can achieve some kind of connection with from elderly persons to their relatives. So we have acoustic and optical control right now. As you see, we're using right now Google Duo for the integration, and also some kind of address book per person. And for the goal, we are trying to integrate more major video providers, so you can choose. It always depends on your contact list. Okay, next slide, please. Yeah, we are in several research projects, especially for vital parameters. And our goal is definitely to have this contactless, or also the combination with the special conditions to COVID. Next slide, please. Here you see we are working on this as a project. It's called Vita Robot, and here we have research cooperation with the Fraunhofer and Logarithmo. And as perhaps many know, Fraunhofer is in Germany a very big instance for research project, and also leading research partner. Here we are talking about the recognition of the patient, and then the contactless determination of vital parameters, all through the camera. So it's all by algorithm and an algorithm supported vital parameter analytics. Next slide, please. Yeah, our goal, so by all these topics I was talking about, our goal is that every nursing home and hospital in Europe will have a humanoid robot by 2025. So we have 5 years to go. And at the moment, from the progress we see, we are maybe even, perhaps more motivated, and we'll see, perhaps even earlier. Okay, next slide, please.
Yeah, that's an impressive long-term goal, Alexander. Maybe can we ask you one short question? What is the price of the solution? So Pepper plus the robot care features?
Yeah, at the moment, the price is about 35,000 euro. Mm-hmm. So this is the integration with all in all. So yes.
That's very impressive. So we support your goal, definitely.
Yeah. Here you see an average usage. This is data we could carry on from all projects we deployed in the last 2.5 years. And it's, the average usage from all facilities. So here you see like general supervision time, general usage daily on a daily basis. Then we have the group program, which is quite new. We have around like 10 partners using the fitness program right now. The individual telepresence possibilities. And here we have to say with COVID, this telepresence is quite increasing. So because at the end, we always have to talk about data and the possibilities on a monthly basis. So with the quantitative aspects, we are aiming at the moment of the usage on a monthly basis on 155 hours. And we continuously get feedback from our partners to have a databases on the usage. Next slide, please. In addition to the current project, which is quite the most challenging aspect with St. Marien Hospital and Professor Schulz, we also from last year or over the last times, we have integrations with Caritas and German Red Cross and the AWO. So these are 3 also big players in general all over Germany. And the Radprax, it's a private institution. They were also quite active at this project. Next slide, please. Here you see, I wanted to give you some more insights on the current situation and the success stories of our product Robot Care. And you see how the acceptance is. So we have a pretty high acceptance. Here you also see my favorite picture again with a group activity, so with a fitness program. And it's quite interesting to see such a product in action. Next slide, please. Once more, so this is Radprax from integration. Here you see also the how people react to emotion, to the gestics, and even high five. And next slide, please. Okay, from our side,
Thank you so much, Alexander. It's really impressive to make a good use of paper this way with your software and experience. So now we're going to go to the audience for Q&A, for questions with Professor Schulz and yourself. And maybe a quick question as well regarding the workload of nurses and doctors. Do you already see, Professor Schulz, some positive news there?
Well, it's quite early, actually. We are right now still in progress, and actually it's the first purpose was just to integrate Pepper in the daily lab work. And what we realized is that this is a machine which has to be supported all the time. There has to be someone with a machine. You can't keep it alone. And on the other hand, we always want to integrate this machine in the daily life in a very humanic way. So to answer to your question, no, we don't have any time savings by this machine, but we plan to do it. And actually what we are right now doing is that we support and train this machine more or less to get it more integrated. And what our plan is that the nurses don't have to measure in a couple of weeks the temperature of these patients and the pulse frequency, for example, because this machine will be able probably in our research efforts to detect this in advance. And on the other hand, we have this emotional parts, and we have to detect the emotion by person right now in parallel to the machine, and then correlate the things and then figure out how it works. So therefore, to make the answer short, right now we have no time savings, but we have a lot of acceptance of the nursing stuff.
That's very interesting. It's the beginning of the story.
Yeah.
Okay, so now we go back to the audience. So how many integrations do you have all over Germany? So I think it's more back to you, Alexander, like how many papers have been deployed? I think over 20 institutions right now.
Yeah, right now, so we have nearly 40 integrations in healthcare facilities. And with the help of Professor Schulz, we also reach out to clinics for geriatrics because it's a special field. And that's why feedback is so important with our project partners, because we do software, we do technical integrations, but all the really professional knowledge about the situation and the use case is brought to us to these project partners.
That's great. So do we have other questions on your side? So I'm just going to have a look at the chat to see if there are other questions. Yeah, so I'm not sure I'm seeing the question, sorry. So we'll have the chat from Noura or Maya coming very soon. So maybe another question for you, Professor Schulz. You've mentioned that some of your patients have dementia, and obviously, like if they're over 80 years old, that's unfortunately a reality. What kind of diseases are currently a possibility for people to help, like Alzheimer or Parkinson patients? Do they have like an importance for interactions here?
Yeah, well, actually, one of the basic tools in treatment of geriatric patients is their functional support and their training. And this starts with a good emotional, stable situation. As you probably can realize that geriatric patients have to be treated with a lot of medications. They have probably 9 to 10 medications a day. Yeah, and they have an average in our hospital, in our hands, they have 13 diagnoses actually. So this is quite unstable situation very often and really very hard to detect every deficit. So in terms of the handling of these patients, we have dementia patients and we have Parkinson patients, of course. Mm-hmm. And the focus is on the functional treatment and the movements of these patients. And so mm-hmm. it's very important for us to influence the mood by these training programs and have an interaction with the machine. And this in a stable way, in a way that you can reproduce these support every day. And this is probably one of the most important benefits, to have a neutral machine which is re-performing every day in the same way, because the reputation of this functional training is very important.
And we know that the routine is very important for Alzheimer or Parkinson, yeah, to make an incentive, absolutely,
and especially, yeah, and it's also important to do this in a very precise way at the same time. So every day is more like a program, actually.
Okay, thank you so much. So another question now, and that's about empathy for elderly isolated patients. And I think that's back to your slides. During COVID-19, it's nearly impossible for the families to get in contact. So do we believe that a robot is giving you a bit of warmth in the hospital?
Definitely, yes. And not all patients react on the machine in a very friendly, positive way. Some don't realize the machine actually, but most of them are happy with these machines and realizing that it's joking and that it's talking about fairy tales and so on. And it's like an icebreaker in this isolation and in terms of COVID-19 situation.
That sounds good. So we're going to move to the next question. So that's to you, Alexander. So how much can facilities and hospital adjust the functionalities of your platform? You talked about this kind of Lego bricks customization for paper.
Yes, so definitely. So that's why we have this on the top, on the Meta side, we have the platform which integrates the different skills. So here, as in the question, you can see about fairy tale, or to switch it with knowledge building. And yes, we can adapt to this and have a complete individual integration. So every facility can choose. And on the long run, yes, we could choose on the patient basis. So, but here we also have to say it depends on the restrictions of the facility, because we always talk about GDPR in this kind of way. So when we deal with patient data and image or face recognition, we firstly have to talk about that. And because from the technical side, we can.
Yeah, we need to respect GDPR, yeah, of course. Yeah. Thank you, Alexander. And another question regarding the, I guess, Alzheimer and memory loss problems. Do you already have like this kind of activations of the memory of patients, or do you already see a benefit on that, Professor Schulz?
Well, that's which question now? The interest,
that's the memory loss.
The second one, Well, right now we just started a couple of months ago to go in really detail how much people can be influenced by this machine. But our first impression is that it's very easy, to get people interested for this machine and the training program. So my experience with the early integration of this machine is very good. We have right now in our special unit for cognitive impairment 20 patients who in average stay there for 19 days. And we start right away from the first day to bring these people in contact with the machine over 30 minutes in the treatment therapy program. So, and it's easy to integrate this machine and has a high acceptance actually.
Very interesting. Thank you. So let's move to the next question, please. So what happens if a paper is stolen? So I guess this is a question for me, probably. Can you remotely disallow information and everything? So we haven't seen any papers stolen so far. Hopefully, I mean, it is a huge robot. Everything is tracked, like the position of the robot, the connections, and even like the workload of the engines. We track everything. So I don't believe this would be an issue, but indeed we can like reset them from remotely, basically. So we don't see that happening right now, fortunately for everyone. Next question, please. So can you explain, like, regarding the personal care, what is needed in terms of interaction of the older patients and the robot? And I think it goes back to the nurse acceptance and how much time the nurses will spend with this paper first, and then how much time paper will save them ultimately. That's the ultimate goal. But maybe you can tell us, yes, maybe Alexander and Professor Schulz, like about the training and the first days of paper at the hospital.
Yeah, so in the case of the integration, so right now, which is quite important, we have the integration of Pepper so he's accompanied by a professional healthcare worker. And as Professor Schulz before had from the ultimate goal is to integrate Pepper. There he is accompanied. And after the integration has some kind of routine, Pepper more and more gets autonomously. And then we have the time slots we save. So that's what we do in the end. So at the moment, because we are in an early stage in the complete healthcare market with service robotics or humanoid robotics, we integrate some kind of technology and the staff gets used to it. And also we get like the feedback data over the last 2.5 years. And also this year, we can see that more and more like fitness training gives some kind of 5 to 10 minute window. And in this window, the person which is accompanied with Pepper can focus perhaps on 1 or 2 persons which need special treatment right in this process. So perhaps to eat or to have some kind of special attendance. Yeah.
Okay, thank you, Alexander, for those details.
And I would like to add some experience from the standpoint of the clinic. We realize already that we have an interaction and treatment of a group in our hospital. Usually patients lie in the bed in a hospital and they get in contact with nursing staff at least for 20 minutes a day. With Pepper, we increase the contact time, and what we see is that we have groups now with really only 1 supporting person, and the machine means that groups like 8 or 10, like you saw it on the pictures, 8 or 10 people are treated and at the same time by only 1 accompanying person. So from the standpoint, from the staff, you save really a lot of time and have more activation time and treatment time with the patients.
That's very positive. So next question. Thank you. So does paper move autonomously from different places and rooms, and how does he decide to interact with? So I think at Entrance Robotics, Alexander, you've started to work on navigation for paper, but is she already going from room to rooms?
So what we do right now is the indoor navigation is that we like step-by-step approach this autonomous interaction. There's also a special condition when we talk about the healthcare environment. So for a clinic, for instance, in many floors, you have the domination of white color. So in this kind of the rooms and the walls, and these are like all with Pepper from his navigation has to try to locate himself. And we at the Mesa Marine, we have an integration right now where he's moving on the floors. But I think the professor can say something afterwards to this integration right now. So we are not at the point right now where like you can say we have 10 rooms and Pepper shall like go from room 1 to room 10 and do it complete by himself. But in the end, that's the goal, right?
Okay.
Well, in our hands, we are interested in to keep Pepper in a special area where everybody knows it's working up to this border and no further. And this is helpful to introduce Pepper more and more in our treatment plans. Right now, it's not our focus really to have Pepper in every bedroom, but it's more important to keep him in a special area where he's able to act and interact with the people who are more or less brought into this activation room. Because we need, especially in patients of cognitive impairment, they need a rest, and they need also an area where not a machine is just coming in and disturbing the science. So therefore, right now, we are quite happy to have a special location for Pepper. And right now, we're training him that he will not be damaged by hyperactive people and so on.
That sounds interesting, yeah. And of course, the attention span of patients with dementia can be low sometimes, so you need like a routine, like you've been explaining.
Yeah.
Okay, so maybe the last question now, last but not least. So question about regulations, like national or European regulations from the health sector to follow before we deploy a Pepper in geriatric houses or hospitals. Well, I will address this question as a beginning to say that Pepper is designed in Paris, in Europe. So we follow all the GDPR rules, and especially regarding like face recognition or personal data, they won't be stored, except if we decide so for a special environment that is as controlled as an hospital with the consentment of the families, the patients, and everything. So maybe back to you, Alexander and Dr. Schulz. What would be the guidelines or best practices in terms of Pepper introduction, like regarding IT, legal, and everything?
Well, this is a touchy point that you are correct. The point is that right now we are still under investigations. Therefore, we fill out consent information papers with every patient, if possible, or with the family members, and we are really declare that these personal data are just located in this machine and not transferred into the internet or somewhere else. So it's very safe in our hospital, very located over there. And this is really a big point, the data safety. And so therefore we have a lot of time right now using and in terms of information of the patients and family members about the data safety.
It's a very important topic, definitely. The data governance in healthcare.
I think it's very important what the professor mentioned here, that from technical side, also connected to GDPR, we are working with many local integrations. So from our platform, it's possible to work with local service. And when you have a complete infrastructure on your side, you are completely autonomous. that's what we do in more facilities.
It makes a lot of sense. Okay, so thank you, everyone. So unfortunately, we need to go. So most of the questions that have been asked in the chat will be answered on by our team and Alexander and Professor Schulz, definitely. We will be there. So maybe as a last comment, so to tell you how excited we are in this new story of paper going to the senior care, elderly care environments. So it's a new job for you, paper, and we see a future for that definitely, and we are really overwhelmed with the results of your first. I mean, this is like the first year basically of paper in St. Marian. So we will follow the next years very positively. And as Softbank Robotics, we want to be like an actor to help the community of healthcare even more. So with face mask detection, of course, but probably with the help of entrance robotics to share this to other regions, other countries. So I think that's something we will try to do. Probably if you follow us on the social media or on the blog with Alexander, we will try to share more stories of how it's going. And probably we'll try to visit you sometimes, Professor Schulz, when the COVID-19 allows us to do so. So thank you so much, Alexander and Professor Schulz. Thank you, Pepper. And we will follow your progress with a lot of attention.